Hi, my name is Bradley Hanselman. I'm a registered radiologic technologist and CT technologist, and my role and goal here is to give you sound information that's both based in logical format and scientific format to give you better outcomes and, more importantly, options that you might not know exist for your own healthcare and people that you care about, and giving you clinical examples of challenges of the modern model of healthcare that we all are seemingly glued into, that we don't know that there's any other structures that really exist outside of these. We face a lot of healthcare challenges with these lack of options in the clinical world, and we have some things that aren't being utilized clinically at a scale that could benefit the global population. So we have a lot of scientific information that doesn't make sense logically, meaning that we have a scientific basis and reasoning, but just because we can do something, should we be doing something with that science? And on the other hand, we have many logical bases of health and wellness that can't be described scientifically or seem to be phenomena, or haven't been or are not yet in medical literature and in the text of science and academia, and which is to say that if we can't do that yet, or it hasn't been done yet, that it doesn't necessarily mean that it doesn't exist or can't provide benefit to the overall wellness of a human being. So today what we're going to be doing is discussing really in terms, again, both in a scientific fashion, trying to, from my point, objectively and not put too many opinions into this, the analogy of the frog in boiling water, and really try to zoom out on this pandemic. And I'm using that term lightly in one sense, because really what I'm going to zoom in separately are two different faces of pandemics that we're being faced with in health. Now, the first one is the boiling pot of water that all of us frogs have been in for many decades and many generations. And then comparatively at the end, I'm going to talk about and tie it all together with the pandemic of COVID, the engulfment that we've been strung along on for the last 2 years now. And so let's just jump right into it. So the first one is the first pandemic, the real pandemic in my opinion, is based on NCDs. Now NCDs is, I'm just going to abbreviate as non-communicable diseases. And so non-communicable diseases are exactly what they sound like they are. They're diseases that manifest in the body that you can't give to another person, but many people are experiencing these, right? These are the cardiovascular disease, the cancer, so on and so forth. I'm going to cover that in just a moment here. But these problems have been on the ubiquitous rise, and it's been so slow that we're more able to normalize these abnormal changes to our body. And so when everything is around us and all our family members and community members and people that we love and care about, and even ourselves, are on prescription pills and on modifications pharmaceutically, we have really taken something that is really profound in terms of the length of human history and the species of human. And when we zoom in on this very small few decades that we're living through with pharmacological interventions, I think that there's a really not enough focus on that. But again, that's the first pot of water. So the other pandemic, again, to reiterate, is one that we all know is the COVID-19 pandemic. Whether you believe it is a pandemic, which I personally don't, on certain levels, it's irrelevant to the dialogue here today, what your opinion is on it. So just keep that into perspective, that my goal here is to compare these two pots of boiling water for you, and to not let us go into 22 as one being in one pot of water and simultaneously trying to get out of that and waking up from that with the ubiquitous and copious amounts of drugs and pharmaceutical interventions and surgeries and things that we see clinically in the hospital that are just putting band-aids on things just to jump into another pot of water and start letting that boil slowly on many different levels. So the problem that really is in our face is how quickly this virus came about. And it's not even so much the health behind it, because I think there's just a complete, just to be frank, overblown response to this globally from a healthcare point of view. But it's the social construct, and everyone is really more afraid of the social constructs and how we've had to change our livelihood in such a, with the oversight of government and the short amount of time, how quickly our lives have changed from a spiritual point of view, a religious point of view, physical point of view, mental point of view, and just overall as what we consider day-to-day lives as being a human. And I think that is really the major context of this video, is that we've really been widely expanding, healthcare failure in terms of public health crises. And, we failed on so many levels, and there's so many different, replete examples of, the tobacco and HIV and alcoholism and all these other things that are true public health crises, or were at one time. But the first example I gave, which is the real pandemic, in my opinion, which is the non-communicable diseases. And so let's start there and use a logical basis and give some factual, scientific basis behind it as well, and how we shouldn't allow ourselves to become these frogs in a second pot of boiling water just to jump out of the first one. So essentially allowing us to boil in two pots of water simultaneously. So let's not go into 2022 without thinking critically on both fronts that we've been put onto. So starting with the first pot of boiling water, which is the non-communicable diseases that are ubiquitously overwhelming to the modern healthcare model and the modern way humans live. And these are the type 2 diabetes, the cardiovascular disease, the cancer, the fatty liver disease, the hypertension, the stroke, the dementia. And, there are subsequent categories of these are major things. So to give a little bit more context to that, within the stroke and dementia, we have other neurodegenerative disorders, multiple sclerosis, schizophrenia, so on and so forth, that are considered non-communicable disease. Do they really tie into, all-cause mortality? To an extent, and the data that I'm going to present here in just a moment does tie into those. So I'm just giving some major categories that I chose to include in this. And so, but just to have a broad general understanding of what I'm getting at when I say non-communicable diseases, with these large oversights of groups that are subsequently affecting many, 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 many people. And I say that not lightly, that many's. So, in the last 2 years, it's really been consumed. Let me just take it back one step. So these problems they're insidious. They're more insidious than the problem that has overwhelmed us in the last 2 years, which is COVID. These have been building up for 50 years, perhaps more in some cases, several decades, several generations. And, when we pass down nutritional deficiencies, for example, these can affect generations and generations to come. And these are some things that we really need to put a large break on and really look at the context of what we're doing to the human race as far as things that drive general processes from, basic function and physiology in the human body. But there's only been educational efforts, and, in all fairness, these have to be voluntary, right? The diet and the exercise. You can't mandate somebody to eat a certain way. You can't mandate somebody to exercise. But, these educational efforts don't seem to work very well. And to play the other side of the card for a moment, when we mandate something, it's not going to work very well either. Look at the mask mandates in response to the COVID-19 pandemic. Do they work well? No, they don't. It's been 2 years, and, quite frequently people yell at me out in public, and it's my response is it's been 2 years. You might have the decreased cortisol levels and stress levels and be, being less taxing on your hormonal system from the subvergent thoughts of that you're doing something for yourself. And I'm all for that. This is what is just on many fronts about, your opinion and your own way of life, and respecting that. So if you want to wear a mask, or if you don't want to wear a mask, I think that's a subject matter that should be individual to each individual person and family and their own beliefs. Because at the end of the day, it's about autonomy in medicine. And if we lose that, then we're going to lose what it means to be a human. So without going down that too much farther, what if there were other layers behind this? What if the ultra-processed foods are really what lie behind all of this? Because the educational efforts, people do try on their own to, say, for example, lose weight and take care of some things naturally, but they don't get a good response in the body. So what if it's, again, multiple layers of ultra-processed foods such as sugar and flour and how they act on our dopaminergic and serotonin pathways and with our neurochemistry pathways, and they really keep us addicted to food and prevent on a subconscious level the physiology to transform within the body to allow for these things to actually, for us to make an impact on our lives when we're trying to counter these things. They really keep us addicted to food. So again, just to say it in a different fashion, what if it's the quality of ingredients and the lack of regulation around this industry that allows chemicals to be added to our foods, and this is the major driver in this pandemic of non-communicable diseases. So according to an article, it was published in 2017 in The Lancet. It was called the Systematic Analysis for Global Burden of Disease Study. And what it really did was it provided an assessment of cause-specific mortality for 264 different causes of death in 195 locations. And they collected data from 1980 all the way through 2016. So non-communicable deaths, again, the stroke, the cardiovascular disease, these accounted for 72% of all deaths. And again, there's some other subfacets in there, such as self-harm or homicide. But generally speaking, these, type 2 diabetes, hypertension, stroke, fatty liver, these things that are really ubiquitous that we see in a hospital in a clinical setting that are seemingly overwhelming. And I'm going to touch on the monetary burden that's been put on us as a whole because of that. Whether you consider yourself healthy or preventative, you're being taxed to take care of this and fuel this system. So to take it back to the present, what I'm saying is that this is, where I have some personal opinions and try to really step back objectively and look at what's happening to our food supply chain. From the time something is produced, processed, and it follows through to the time that humans actually consume this, the amount of ingredients that are ultra-processed in our foods, and they have hidden labels. And I mean, the amount of, to add some context, the amount of different ways you can label a sugar to not label it sugar is really concerning. And I think that people, if you don't see sugar, humans are basic. Just consider like a Google search. If you're not going to, people don't scroll past the first 3 results. That's why you have ads and then you have the first few results. And then, 95 or 90% of the people who do a Google search are going to click on that first page. They're not going to go below the fold is what it's called and actually scroll down and do some deeper digging. So, you can actually buy that attention. And so you can actually buy your way out of labeling, with the regulatory industries, I should say regulatory oversight for these industries. And that's something that I think is really concerning. I think more people are becoming more awoken to over the years. And you see people more, reading ingredients and trying to figure out what they're actually going to be ingesting and bring home to their families when you see people, looking on the back of a box in the grocery store. So, with that said, the amount of ingredients that are truly ultra-processed in our foods should have a higher level of oversight and regulation. So let's look at the other side of the equation here, which is, the monetary burden that we all face. Whether you are extremely healthy or you're not, whether you have regular doctor visits and medical intervention with pills, surgeries, so on and so forth, or wherever you're at on this scale, you might be, an exercise freak and take supplements and stuff, but you might hold a regular job or which most people do. And so we're being taxed and, we're all subject to these things that essentially make us whole in the system. So, we're buying into this and we're all being burdened by an overwhelming increase of money that has, it's used for the morbidity or mortality that's related to these NCDs, these non-communicable diseases. And according to an article that I found, it was from 2018 from the LA Times or Los Angeles Times, the U.S. government reports that Medicare is going to become insolvent by 2026. which means it will not be able to keep up with the monetary burden at which we're acting on as a whole, and putting people underneath the monetary structure within modern healthcare because of this. And that's actually that was in 2018, which is 3 years earlier than what was previously forecasted. And Social Security will become insolvent by 2034. Basically, the amount of money that the geriatrics and the older generations need to be taking out will not be offset by the younger generations buying into this. And so this is something that perhaps needs to be covered more in depth in another discussion. However, expenditures of healthcare are not sustainable with the loss of economic productivity, even more so in the last 2 years with small businesses being squeezed. And, this is not restricted to the U.S. alone. The United Nations, the UN, declared that non-communicable diseases was a global health crisis that posed a threat to the survival of many countries, which plays a global role naturally. So let's address somewhat of the elephant in the room, at least in my experience clinically. The top-down knowledge, so to speak, from traditional schooling of modern healthcare, which gets portrayed onto the patient by somebody, they go to the doctors, they go to their clinician as someone that they trust and form a relationship with. And this is something that people, for the most part, hold dearly, whether we're that frog in the boiling water or not. People, like to pretend at least that they're caring or thinking that they're playing a role in their own health, which, again, is an interesting facet of the human psyche to me, that people try to remove themselves from empowerment. But again, that's part of the system that we're all put into. So to put some context to this, just one facet of this top-down knowledge is that, a calorie is just a calorie. And this is, from a trusted source. So, if you were to take that slogan, so to speak, that a calorie is only a calorie, then the processed food industry can counteract that and basically run with it, I should say, and say that this calorie can be just a calorie, or is just a calorie, it doesn't matter where the calories are coming from, can be a part of a balanced diet, and can only further the problem that we're slowly killing ourselves with food. And so let's put some context to this. The cancer industry is really saddening. We have patients who are losing weight, they can't eat, chemotherapy, and just other things. The disease itself likes to eat away and cause cachesis, wasting away of the body and just metabolizing oneself until you slowly pass away. And, I've seen firsthand physicians and oncologists, I'll say keep this within, not to group everybody together because that would be, wrong of me. They say eat ice cream, eat candy, take some Jolly Ranchers, literally off the oncologist's desk, because a calorie is just a calorie, and this is a caloric game that we're playing with you. And so, we have a lot of data, scientific literature that conflicts this and actually reflects a better outcome for both the quality and the quantity of a patient with cancer if they just were to eat more nutrient-dense, more whole foods, things that literally grow out of the dirt, versus the ultra-processed calories that are readily available. Again, they're highly palatable, highly addicting, but nonetheless, they alter our neurochemistry, they alter our gut health, which in turn, plays back on the gut-brain axis, our overall gut health, our DNA expression, our metabolism, and our hormonal pathways subsequently. That's literally about every process in the body. Just by adding some sugar into the body. And I think it's really unfair for patients to be told this. So, most clinicians attribute the growing NCD, non-communicable disease problem, to the growing obesity prevalence because of the quantity of food being ingested. But really, it's the quality of food being presented and ingested in the body that is the major driver in these NCDs. So the processed and ultra-processed sugar and the ultra-processed flour, it chemically energizes our dopaminergic system, for example. We can cover that more in a later video if you guys want, some of the physiological changes and neurological changes that occur. And, that really gives us that chemically altered experience of, appetite, natural suppression of appetite, and imbalance of, the hormones that are related around this gut-brain axis that I just mentioned, such as, ghrelin, leptin, insulin, and how these all tie together, and how they, tie into addiction and, bulimia and anorexia and inability to lose weight and insulin resistance and so on and so forth. And these cyclic loops that we can't get out of, and why people lose weight or they're addicted to food or they're addicted to sugar and so on and so forth. But, what I really want to cover before I do go down that hole is, I'm going to keep it super short, that, we have our dopamine center, which is a reward center. It drives reward, and it's seated in our nucleus accumbens. And when we have downregulation of our dopamine receptors, which has therefore behavioral alterations consistent with, abuse, be it, food, alcohol, so on and so forth. Again, addiction on many different levels, food, drugs, and dependence, hence, which is my argument for ultra-processed foods like sugar and flour being addictive, just like cocaine and heroin. When you look at these plants, the coca leaves and, the poppy plants, they are not inherently addictive until they are taken, ultra-processed, they're refined, and then consumed by the end user, and that is where we start to have problems. And so, again, when we take sugar, cane sugar, and we take, flour, it doesn't matter if it's almond flour or wheat flour, they're not inherently addictive, but the way they act on our neurochemistry when we're take them and refine them and then sell them and then eat them is a major problem. And so we're really eating ourselves into a worse and worse hole with this, this theme here that I'm presenting of we have a frog, we are the frog in the water, and we're eating ourselves, and the more we eat ourselves into this, the higher the temperature is being raised. So let's switch gears here. We see these problems happening in front of us within our household. It's been 15 years since 16 years now that my mom has died. My dad became diabetic shortly after, and he went on a sugar binge. I remember him drinking almost a gallon on some days of the Ocean Spray crayon apple juice. He's like, this is so good. And shortly after, he was having insulin resistance and sugar problems, and boom, full-blown diabetic. Now he's half in the natural world, half in the allopathic world, and he has those options presented to him. And that's the most important thing that I could give as a takeaway from that is he's happy with his foot with where it is, and we're happy for him. At least he's half in and half out, rather than, in my opinion, all the way out and all the way with allopathic. I feel like his general health would be much further down the line if he wasn't taking, supplements and using essential oils and drinking as much water. He drinks more water, always has drank as much water and eaten as much salad as anyone I've ever met in my life. So, just on those basic physiological functions that we can pull from those, basic nutrients in water, and a half dose of supplements a day, it's really interesting to see, the disease process just plateau. It's not doing him bad. It's at least not as worse as it should be, as if he wasn't doing these things. So, although, it's created a dependence on food in some ways. And I know many people who are listening to this are feeling that as well, that you create, or someone in your family has created a dependence with food. And it could manifest itself physically, in this case, diabetes. It's been 15 years and it's normal to us. It's normal to our family, just like it's normal for you and your family, or perhaps yourself, to take prescription pills for your diabetes, for your hypertension, to poke your finger and, with a glucometer, or regularly take your blood pressure at home. Or whatever else you might be struggling with for a long time, often several years, and stay stuck in this cyclic inability to cut open the circle, so to speak, and remove yourself from that model that keeps you inside. So just like it's been normal for us to increase our diet to 56% ultra-processed food, which of that 56% ultra-processed food, 62% of it is sugar. And that is just in the American diet in this category. And that was according to an article of JAMA Internal Medicine in 2020. So the ubiquitous usage of sugar and other highly processed compounds has become so regular that without standardizing and the standardization of regulation behind it, it's really a major factor in driving healthcare costs up. And I just want to bring this to the table because we need the change. I don't see many other people within the allopathic health space whether you're, half natural. And again, my angle is to teach you how to use allopathic medicine and when to use allopathic medicine, when to consult with your physician. And if you do not want to go down the allopathic route, or you want to integrate, then here's what things that you can do to, first off, empower yourself, but to steer the course away from the allopathic dependency, because there's no such thing as a cure when you walk inside the hospital, but there's things that you can take care of that are cheaper, safer, and more effective for these non-communicable diseases and many other things that are, chronic diseases, from the comfort of your own home oftentimes. So, wherever you're at on that scale, I just want to bring that to light, that we need more healthcare professionals speaking about this and these problems. And there's a lot of data. I'm pulling just very, very simple data to present my case here for you guys. So with that said, the COVID situation globally is now taxing us at unprecedented rates, in all aspects. There's the financial aspect, there's the spiritual, there's the mental aspect. And it's the basis of this that I really want to conclude on for this message and this talk here. But the COVID situation around the world has really crippled us on many levels. And I've seen clinically more domestic abuse and self-harm inflicted without, sharing too many stories. You can really just, open up your imagination, or, recall an account that you've witnessed it or heard a story, and just times that by 10. It's taken out of context from the cited numbers earlier. That global burden of disease study was from 2016, before we had this, before we even had Aunt Rona visiting us around the world. And so I can only comment on this anecdotally, but I'm sure many can agree, both in healthcare and without, if you're just an average listener, or, an avid, someone who's interested in this topic, or just, a listener, that there's been an increase in domestic abuse and self-harm. And not only that, but we've had an increase in neuropsychiatric disorders, namely stress and anxiety, just to scratch the surface, but, which can in turn fuel so many other causative and relative problems in the body, which then can manifest themselves as physical illness if left untreated. So I'm just going to wrap up by saying, let's go into 2022 not with the allowable tolerance that we've had over the last several decades. Let's learn from our previous generations, and let's learn that these NCDs, these non-communicable diseases, consuming 74% of the deaths, and all the money that comes along with trickling people down the symptomatic modern healthcare model. And so for people that really just say, trust the science, you shouldn't always say trust the science. You should be critical of the science always, because that's how we learn as a culture, and that's how we learn and grow as a species towards, better care, cheaper care. And if you just look up the data, I don't have it here in front of me, of how many people are subject. I think it's 70,000 people a year are subject to, and feel free to correct me on this, 70,000 or so people a year just in America that are subject to amputations just from type 2 diabetes, compartment syndrome and all the problems related around that. It's really, really sad to see. So, if you trust the science, then, and not be critical of it, not saying we shouldn't trust it, but we shouldn't stop there and accept that as the end result for the end of time. We have to keep moving and keep getting better and getting better. Otherwise, that's just really leaving your hands up to a system that you can't get out of in many aspects. Once you lose a limb, you're not getting it back. So in any case, I think that, if we're slowly allowing ourselves to get used to these regulatory bodies controlling all aspects and every facet of our daily lives in the face of a quote-unquote public health crisis or global health crisis, but, again, I think that there's a little bit of objective words here coming, but a little bit of opinion too, that if public health was as paramount as claimed for the last 2 years, I believe that there'd be more focus on natural ways to cope with even just stress, not even the physical things, but, let alone the natural ways to boost our immunity to viral infection. It's been 2 years without any mention from mainstream about vitamin D and its association with decreased upper respiratory infection and overall ability to reduce all-cause mortality. That's a really strong driver, all-cause mortality, with such a simple thing that we can, supplement with. And, this is just one component of a very complex immune system that we have. And it's just one component. Very early on, I mentioned and made content around. You can go back into my Instagram and YouTube where I posted that. It was very, very early on. It's cheap, it's effective, and it has the natural ability to intervene on a host of regulatory processes in the body that can cascade into overall optimization of health, or in the opposite fashion, the downregulation of many facets of our health. So let's not be a frog in a new pot of water. We already know that we are in one pot of water, as I stated very early on in this talk, and we've been slowly increasing the temperature for many decades and many generations. So while many people are waking up to the possibilities of both a natural and modern integration for the most healthcare model possible moving forward, where many people are thirsty for this integration, and we're thirsty for change. But let's not be so quick, ladies and gentlemen, to jump out of that pot of increasingly warm water and jump into a colder pot of water to seem cooled off. And this is the COVID pot of water. Just to let that slowly increase in temperature, just as insidious as the pot of water that we just got out of. So that's my hope, is that you take this knowledge and apply it to 2022 in ways that you find meaningful to you. And that is where I'm going to stop it. But don't focus on the social constructs. We're so focused on the changes of life, and we're not looking at the end result of what it's going to do to our health, physically and mentally. And that is where I'm going to end this. Don't be so quick to jump out of this pot of water. Stay in this pot of water. Let's learn to cool down this pot of water and also deal with the pot of water that we're trying to jump out of and jump into the next one. Let's not be in two pots of water at once. Let's learn to deal with the comorbidities and the morbidities themselves, the heart disease, the cancer, the diabetes related around food, and we wouldn't have, even if this, in my opinion, was a true pandemic. I always pose the question, if you turned off your TV and stopped listening to mainstream media and you just went outside, talked to neighbors, went to the store, would you have a pandemic-like experience around you? No, I don't believe so. And again, that's just my own opinion. So I encourage you just to carry that thought with you, and we wouldn't have a problem on the scale in which we would if people just knew that we could take care of our bodies from a more natural sense, and there was more integration and more focus around the natural ways to boost our immune system in these times. So I think I've stated my case and wrapped this up here pretty well. So thank you. If you enjoyed this or you are learning from this, I kindly ask you to subscribe to my YouTube. It's where I put my long form content. It really helps me. And in addition to that, please put comments in the comment section if you have any. Also, in addition, please follow me on Instagram and keep up with the shorter clips. I post some reels. I try to add some humor to these conversations. I really kind of have two modes. I have a sarcastic mode, and I love making people laugh, but I also have a very serious mode. And oftentimes people can't deduce the two from one another. But with that said, if you like the day-to-day content, the 24-hour stories and stuff like that, please follow me on Instagram. And lastly, if you want my help with personalized natural healthcare solutions to your own healthcare problems, please fill out the form that says "Help Me." You can find it both in the description of the YouTube videos as well as the link in my bio on Instagram. So thank you for your interest in natural health, science, and most importantly, the empowerment that you get by learning how to utilize both sides of healthcare in the future.